Welcome to this learning module on dealing with peers and superiors on a medical team. Next to patients, dealing with peers and superiors is probably a doctor's most critical professional relationship. That's because medicine is a team activity. Very few doctors practice alone anymore. Nearly all are in hospitals, clinics, or partnerships where they must work and cooperate with others. The growth of managed health care is likely to expand this. At the same time, however, the nature of medicine makes teamwork difficult. Almost by definition, the work is stressful, intense, and exacting. There is little tolerance for mistakes and a great emphasis on being confident and decisive, even when there are multiple choices in diagnosis and treatment. In this environment, it's perhaps not surprising that tensions may rise and disagreements occur. It's perhaps not surprising either that being part of a team and knowing one's place on a team are among the most common concerns of medical students. Briefly, our objectives in this module are to, first of all, examine situations or conditions where teamwork may be challenging, especially for medical students. Consider the effects of negative, disruptive behavior from peers and superiors, and why it must be faced even though it's easier to ignore. Third, to examine the nature of conflict on a team and the difference between constructive and destructive conflict. And fourth, to consider ways to resolve conflict and improve team effectiveness. Our key point is that conflict and disagreement will occur on a team. They're almost inevitable. But they don't always have to be endured or accepted. Often, they can be resolved through good communication. Let's begin with a little exercise. On the left are 5 common situations a physician may face. On a 1 to 5 scale, with 5 the highest, rate your comfort level in handling each one. When you get to the last one, click once more for an interesting figure. In a recent survey of medical students and residents at the University of Maryland, over 60% said they'd be at least reasonably comfortable doing these things, say 3 or better on that 1 to 5 scale. Chances are you would be too. They're pretty standard tasks in patient care. Now let's look at a different list. On the right are 5 more situations. Rate them on a 1 to 5 scale, and again, when you get to the last one, click once more. On this list, less than 40% of those survey respondents said they'd be reasonably comfortable. Chances are your ratings were lower too. Why the difference? Well, obviously these situations deal with fellow doctors, where your authority isn't as clear, and the risk of giving offense seems to be higher. The first 3 will be considered in another learning module on reporting medical errors and impaired colleagues. For this one, we'll focus on the last 2, dealing with superiors or peers who are acting unethically, and disagreeing with a superior's medical judgment. For the sake of simplicity, we'll define unethically very broadly as any act that seems needlessly harmful to other people. Think of it as the equivalent of unprofessional. Students face many problems in their rotations or clerkships, from being asked to do things they don't feel qualified or experienced enough to do, to being asked to do things they might find morally questionable. But surely one of their toughest problems is working with peers or superiors whose behavior is so inappropriate as to be disruptive. And they're not alone. A 2011 survey of physician hospital administrators shows that the problem is common for everyone in healthcare: nurses, technicians, other doctors, and staff members. Disruptive behavior included both overt acts like verbal abuse, or in extreme cases physical abuse, and covert ones like being uncooperative. But it's important to say that whatever the act, more was at stake than a bruised ego or some hurt feelings. The survey cites a number of cases, one where a physician with a long history of abrupt and rude behavior yelled at a nurse, and this resulted in a significant medication error and harm to a child. Workload stress was the most common explanation for these acts, but interestingly, a second was behavior learned in medical school. Of course, no medical school teaches students to be rude or abusive, but there is the so-called hidden curriculum, the culture of medical school that says, in practice, that maybe it's okay to be rude when you're doing something really important, and communication skills are nice, but they're not really essential if you're good at what you do. As the author of the survey writes, combating the phenomenon of disruptive behavior is an uphill battle. For many of us, this is behavior we learned from abusive instructors in medical school. The constant stress, long hours, and bureaucratic quagmires inherent in healthcare serve to exacerbate the situation. Historically, physicians behaving badly have been tolerated, sometimes even celebrated. Think of all those TV doctors who rush into the ER shouting orders right and left, intimidating everybody in the room, being obnoxious, and they get away with it because they're saving lives. Well, no more. In 2009, the Joint Commission on Accreditation of Healthcare Organizations, which accredits hospitals, released the new set of standards on disruptive and inappropriate physician behaviors. It calls for zero tolerance for these behaviors and requires organizations to develop and implement systems for detecting them. Offending doctors may have their hospital privileges suspended and be required to take anger management classes, which every state now has, by the way. Their licenses might be suspended, or they might be revoked, and their insurance might be canceled. Now, if all this seems too extreme and too depressing, let's say that disruptive behavior isn't unique to medicine, certainly. Every profession faces it. And the number of doctors who are chronic offenders is really very small, an estimated 3 to 5% of all physicians, according to one study. Some of the behavior is quite innocuous. Anyone could have an off day or maybe tell a joke that isn't very funny. But if it becomes a pattern, something you're known for, it's serious stuff. Again, it hurts more than people's feelings. It can affect workplace morale. It's a good source of moral distress, as we discussed in an earlier module. It's a source of employee turnover. It exposes an organization to greater legal liability. And ultimately, it can be a threat to patient safety. Okay, time for another exercise. Here's a question from the U.S. Medical Licensing Exam. Read it, pick one of the choices, A through F, and then click again at the bottom for the preferred answer from the Kaplan Guide. The answer here is E because, according to WebMD at least, beta blockers are a good treatment for congestive heart failure, so the attending physician seems to just be wrong. This makes the disagreement a quality of care issue, which is normally handled by a hospital's chief of service. Another choice, though, could have been F, which the USMLE first suggests in physician disagreements. That is, discuss, confer, and try to reach consensus with a physician on the basis of evidence-based medicine. So, if you felt comfortable meeting with the attending, this would be a good option too. The question is, of course, how would you go about it? Basically, talking to someone who's acting inappropriately or trying to resolve a disagreement with somebody is hard because of one word: conflict. Most of us don't like it. It's messy and emotional. We don't feel we handle it very well, so we avoid it if we can. But the first step in getting someone to understand you is to realize that conflict can really be seen in two ways. One is destructive, where it's characterized by emotions like anger, resistance, resentment, alienation, competition, sabotage, and this is often what we think of when we think of conflict. We don't want to make people angry or resentful. We don't want to make enemies out of them. There is, however, another way of looking at conflict, and that's constructively, where in place of these emotions, self-analysis, reevaluation of a position, perspective, respect, cooperation, and reinforcement may occur. The point is that conflict can be bad or good depending upon how it's managed. It can surely break a relationship, but it can also strengthen it. The trick, of course, is to try to make it do the second and not the first. So, what are the steps in constructively resolving a conflict? Well, this is a complex subject and whole books and courses have been written on it. But in brief, first, choose a neutral time and place after people have calmed down and where neither party has a power advantage. It's sometimes tempting to confront someone with whom you disagree right away, to strike while the iron is hot. But to carry the analogy further, sometimes that just means that one or both of you will get burned. Secondly, state the issue clearly and objectively, without laying fault or blame. As much as you can, even if you're pretty emotionally involved in the situation, stick to the facts. What exactly happened? What was said? What was done? And avoid interpretations, why it happened. Avoid imparting motives to the person as to why they did or said what they did. You don't know for sure what their thinking was, and so just leave that to the side. Third, state your concern. What bothered you? Why? And what do you want to happen now? Fourth, and this is very important, listen to the other person's response, which of course means you give them a chance to respond, without judging. It's possible that you may have misunderstood what happened, or that there may have been, at least in the other person's mind, a good reason for it, which when you hear, you will have to agree is plausible. Seek a mutually satisfactory solution. Ideally, conflicts should result in win-win results. Solving a problem is more important than being right or getting an apology. And finally, try to end the meeting on a positive note. Even if disagreements still exist, even if you can't come to consensus on everything that could or should have happened, focus on what you've accomplished. Otherwise, dialogue stops. Think of those situations where you've been in conflict with somebody and an attempt to resolve it has ended badly. Do you want to keep talking to that person? Do you want to try again? Probably not. Here are some additional tips on resolving conflict, specifically in medicine, from the School of Medicine at the University of Alberta. First of all, address the conflict early, before it becomes more complex. Time doesn't heal all wounds. Sometimes, to use the medical metaphor, it creates scar tissue. It hardens people. Anger turns to hostility. The more you think about what was said or done by another person, the more angry and resentful it makes you. Second, separate the person from the problem. Think about it. Saying "you're rude" is different from saying "your remark upset people." Aim to criticize a person's behavior, not their character. People might be willing to change their behavior, but it's very difficult for people to change their character. Third, don't tell everybody about the problem. This is important. In conflict situations, it's often tempting to try to seek allies. If you feel you've been wrongly treated by somebody, it's awfully tempting to tell other people about it so they'll sympathize with you and you can build up support. But unless or until you have to, it's usually best in a conflict, certainly with a superior, to keep the issue private. The more people that are involved, the more likely it is that the situation will get distorted, that opinions will be created, that abstractions and fabrications will occur, and it may be more difficult for people to change their positions. Fourth, focus on interests rather than your position. Again, you're not so concerned, or ought not to be, about winning the situation or triumphing in the situation as in getting the problem solved. So focus on what you want now rather than your position. Take a look at stating your concerns in that last slide for a review. Fifth, avoid blame. Listen to the other person. Try to understand that person's perspective. Again, see listen without judging on that last slide. And finally, focus on the future. If you think about it, when conflict occurs between people, once it's over, what happened, happened. It can't be undone. It can't be changed. Your goal is to see that whatever happened doesn't happen again. That can be changed. Finally, here are a few additional practical suggestions on conflict resolution from me, based frankly on some 35 years of teaching human communication in a variety of settings. First of all, don't make enemies you don't need to make. If an issue is small, if it's possible for you to let it go, chalk it up to a person's bad day or a remark that was well intended but went astray, let it go. People are people after all. Sometimes they do or say things that are just kind of stupid. They may know it, even if they can't admit it. And sometimes you'll make matters worse by trying to improve a situation. Secondly, remember that words don't mean anything. People do. If you're upset by a word that somebody used rather than an action, ask yourself, do I really think the person meant what they said? Or did I just hear that? Was it my reaction to that word that really caused the problem? Could they have been innocent in their comment? Could they have been ignorant of the meaning of that? If so, then maybe it's best to let it go. asking whether the word is what's setting you off might give you a good idea of who's responsible for solving the conflict. Third, stop one sentence short of the last thing you were going to say. When you state your concern, when you state your grievance to the other person, avoid that last little comment that you might want to make, because interestingly, it's often that last comment that gets you into trouble, that twists the knife a little bit too much, pushes the other person off the edge of agreement and into firm resistance. Have you ever been in a situation where you've been arguing with someone and at some point you've realized that they're right and you're wrong, but you can't admit it because you've committed so much to your position that to retreat would lose face? If you've ever been in that situation, you know what it means to feel pushed too far, to the point where you can't retreat from your position even though you'd like to. And that leads to the last comment here. Always leave the other person an out. Let them agree with you without losing face. Be tentative in your judgment of what happened. Give the person a chance to change their position without admitting error. Well, now it's time to see what you've learned from this module. Here are 7 questions. Write an answer to each one, and when you've completed them all, check your answers against the ones in red on the left. How did you do on these? If you missed anything, go through the material again. And if you'd like more information about any of the topics here, see the links attached to the module or write to the email address here. Thanks for watching.